Okay, so where are we? Let me see. Okay, ayan. Naka-live na tayo. Hello everyone and welcome today here in Life with Mami Loy. Sorry po tagal ko na kasing hindi nagamay itong StreamYard pero thank you for joining us today here in what I call this as an awesome connection. So, this will be hopefully a monthly thing for us here in Life with Mami Loy. Ako nga po pala si Mami Loy. Mom po ako of a child with autism. And this is a special monthly webinar na gusto ko sanang i-dedicate dito sa community natin of parents of kids with autism and ADHD. So, it has been so long since I have last have this kind of virtual talk. And here, but remember we started po noong ang pangalan pa ng page ko is Pursuing a Better Life. Ayan. So, as a mom who also experienced the journey of having special needs child, I feel that there's so many of us na need ng mga ganitong discussions and show. I made it, what you call this, a lifelong mission to help parents like me, especially yung mga na una pa lang no, kakadiagnose ng mga kids nila na may special needs. So today we'll be discussing music therapy and we're featuring and thank you sa pagpapaunlak sa akin sa acting special guest si Teacher Jenna Gania all the way from Netherlands. Yan, the land of the cheese, tulips, and chocolates. Ayan, welcome to our very first awesome connection, Teacher Jen Jen.
Thank you po. Thank you, Ma'am Loy, for inviting me. And good afternoon po sa lahat ng nanonood ngayon sa live stream.
Thank you. Yan. So, dear parents, Teacher Jen Jen is actually a music therapist working with people with dementia, and she's currently living in Netherlands. So, let me first start my first question, teacher, about music therapy. What is it exactly po ba, yung music therapy? Though naririnig ko na po yan, pero medyo vague pa rin yung pagkaintindi ko sa music therapy.
Okay. Ang music therapy, ano po siya? Clinical and evidence-based use of music interventions to address physical, emotional, cognitive, and social needs of a group or an individual. So, ang music therapy is a non-pharmacological treatment. So, it means hindi po natin kailangan ng medicine. So, music ang kailangan po natin. And music helps the variety of disorders such as anxiety, depression, autism, dementia, stress, etc. So, yan po ang explanation ng music therapy. Clinical and evidence-based kasi po based po siya sa research. And clinically, ano po yan, talagang profession po yan, music therapist as a music therapist, professional. Okay. So, yung idea po kasi ng music therapy, I mean, yung healing method po is since ancient times, present na po yan. Like, for example, yung mga Greek doctors before. So, gumagamit po sila ng mga string instruments such as lyres, flutes, zithers to treat their patients. So, for example, someone is feeling depressed, so gumagamit po sila ng music. So, noon pa po kilala na yan. And ang earliest known reference po ng music therapy is nag-appear noong 1800s. Ito pong source na to is pinanggalingan sa Amerika. Bali, yun pong time na nagkaroon na ng interest ang mga tao, mostly mga psychiatrists, mga ganun po, sa yung healing method po ng music. And noong 1800s, dun din po lumabas yung yung first recorded na music therapy intervention in an institutional setting as well as yung experiment in music therapy. So, nag-continue lang po yung interest noon sa music therapy until sa 1900s and then dumating ang war. So, nung pong time na yun, nagkaroon na po ng mga journal, ganun po mga libro, books, regarding po sa pagpapalaganap ng knowledge about music therapy. And then, noong 1940s, dun po na-develop ang music therapy as an organized clinical profession. So dito po yung nag-invite ng mga doctors, for example, sa Veterans Hospital, ng mga musicians, amateurs or professionals, para po mag-provide ng music sa mga patients po nung war. And then dun po nila nakita yung magandang effect sa both physical and emotional trauma na galing sa nadulot po ng war. So maganda po yung effect na nakita. And then doon po talaga nag-start yung idea na, okay, bakit hindi natin gawing profession ang music therapy? So, doon po start, nagkaroon ng organizations, nagkaroon ng mga schools, and then doon na po, nag-start na yung
So,
ano.
this is like teacher a 4-year course po? Parang ganyan?
Opo, bali, bachelor po siya, Bachelor of Arts. So, 4 years
Ah,
po. Opo.
okay. And this is your like second profession?
Opo, second profession ko po siya. Bali, nung 2016, dun po ako nagkaroon ng chance na i-take ko itong course na to sa tulong po ng stepfather ko kasi nakita niya somewhere sa newspaper na music therapy. And then hindi ko po kasi alam na nag-exist pala itong ganitong klaseng course. And then nung narinig ko, nag-inquire ako and then papasok. And then graduate ako noong 2020 lang po. Nung nag-start ng
Mahilig
pandemic.
ka ba sa mahilig ka sa music kaya parang na-incline ka rin kunin din siya after your grandfather told you na may ganito palang profession?
Yes po. Opo. Kasi
Okay.
music is my passion. And naisip ko po na, kasi para sa akin powerful ang music eh. Kasi,
Mm.
siyempre, personally, meron akong magandang relationship sa music. And then I think sa ibang tao may ganun din po. Lalo na sa Pilipinas, for example. Yes? Kasi sa atin, music is part of our everyday
Part
lives.
of, oo. Wala atang Pilipino na di marunong magsayaw or kumanta, di ba?
Yes, di ba po kilala ang Pilipino sa
Oo.
music
Talent
talaga.
natin, di ba?
Yes.
Oo. Totoo,
Opo.
totoo. Ayan. So, interesting, no? Interesting. This is very interesting. I made a few research then and mako-connect ko nga sa community ko kasi to teach. Kaya sabi ko, why not discuss this certain topic here in our community? And I learned that music therapy also helps kids na may special needs to identify, mag-express, and mag-control ng emotions nila. And ang gusto ko lang sigurong kung may impart ka na about this is yung how do you think that is being done or how does music therapy does it yung parang i-allow niya or helps niya yung special need children to identify and express or control their emotions.
Una po sa lahat, music is a non-verbal form of therapy. Bali, hindi mo po kailangan makipag-usap unlike sa cognitive behavioral therapy na talagang talk therapy siya. So, sa music is nakikita mo po ang behavior ng isang tao through music. Katulad po ng kasabihan na you are what you eat. So, sa music,
Mm.
you are what you play. So, for example, sa active form po ng music therapy, for example, ang isang bata, in-invite mo and then magpo-play kayo together, makikita mo po yung energy level, so mababasa mo kung paano tumugtog ng music ang bata. So, hindi po kailangan na talagang magaling sa music, pero yung behavior niya po, makikita
Mm.
po na-appear yun sa music.
Mm.
And
Ano
then,
lang, share ko lang din, teach, kasi naalala ko bigla, yung nung time na heightened din yung behavior ng anak ko, si Louie, yung bunso ko. That was nung 2 and a half hanggang mga 3 years old siya. May mga certain music akong piniplay sa kanya na pagka narinig niya yon and then tinry ko na siyang start na yakapin, parang nagka-calm down na siya. Tapos parang unti-unti, kasi during that time na at peak of ano siya behavior niya, aggressive talaga siya, nangangalmot siya, nagbabite. So pagka nakikitaan ko na siya ng gano'n, I would usually, instead of scolding him or iba papaluin ganyan, yayakapin ko yun din, ipi-play ko yun sa phone ko, yung certain music niya. Very particular siya sa music eh. So when that particular music plays, it's like an instrumental music lang. And when I play it with him, maya-maya parang yung iyak niya, yung nagbababa na siya, then hindi na siya nananakit, tapos may parang almost matutulog na after nun. Parang gano'n siya. Pero of course, not at all times, kasi may mga times talaga na pag nasa labas kami, hindi ko naman agad-agad malalabas yung phone ko. Tapos, mag-meltdown na lang siya dyan sa street and all.
Mm.
So, but it helps, especially pagka nasa bahay po kami. So, parang ako mismo may personal experience ako na, at that time, di ko alam na ano yun ha, na parang it's it's yun nga music therapy na pala siya or what. Parang sa akin nagkataon lang na I was just trying my best na ibigay dun sa anak ko yung ano yung maaring makapagpakalma sa kanya. Trial and error ako sa anak ko at teach eh. Kaya isa yon sa mga na-try ko before. Yan. Sorry na-interrupt kita. Sige, please
Hindi
proceed
po.
po.
Actually, very valuable po yung sinabi niyo ngayon. And marami akong, una po sa lahat, very important po yung ginawa ninyo, eh, no? Kasi, bago ko po tanungin kung anong klaseng music yung pinatugtog niyo, nabanggit niyo naman po, instrumental, ano po ba ito?
Instrumental, calming.
Soft
Soft
music,
siya.
calming, calming. Okay. Kasi po, una po sa lahat, ang music is of course, music is a stimulant. So, kapag nag-present ka ng music na soft music, of course, ma-experience natin siya as something na slow. So, nare-regulate po in that way yung energy natin. And pag nag-present ka ng music, yung mga upbeat songs, di pa po napapasayaw tayo. So, yun ang
Yes.
test ng music sa atin. So, yung sinabi niyo po na kapag ka nagkakaroon ng, nagpapakita ng ganyang behavior po yung anak niyo, and then nagpapatugtog po kayo. And one thing po na binanggit niyo is, sa tingin ko very important, is yung niyakap niyo siya. Yung
Opo.
niyakap niyo po siya. Right? So, isa po kasi yun sa importante, no? Yung i-align mo, i-attune mo yung energy. I mean, I'm using the word energy, pero yung kung ano nyo, I think mas madali pag energy po sinabi ko. Yung i-attune mo sa state ng yung emotion ng anak nyo. So, importante po yun kasi hindi lang magpa-present ka ng music and then tapos na. So, kasama po talaga yung comfort nyo and then yayakapin nyo. And then, nakakatulong po yun sa, sa pag-subside ng kung ano man yung distress o kung ano po yung problema at that time. So, very important po yan, yung sinabi niyo. And that's good. Maganda. Masaya ako malaman.
Una kasi, he is actually, that time may sensory, issue siya eh. Kaya alam ko na touch could probably help him. If not, yeah, yun yung madalas na nangyayari before. Pagka siguro overloaded lang siya, kaya nagme-meltdown na siyang ganun, kaya kailangan ko ng, okay, andito lang ako, you need to feel me again, na nandito lang si nanay, parang ganyan. And then, yun, siguro isa din yun sa mga, naramdaman niya. So, I'll proceed with question number 3, Tish. Is, music therapy's approaches differ in each level of whether it's an adult or a child. And halimbawa for babies, ganito yung need mong gawin. For adult naman, dapat ganito. Pag grade schooler, ganito. So, can you help us po understand if may pagkakaiba yan sa approach?
Well, I think ang difference po ng approach kasi sa edad is yung level of understanding ng bata. So for example, sa baby, hindi po, kumbaga syempre ang baby hindi pa nila kayang magsalita, right? So puro sense, nagsisense lang po sila sa environment nila. And iba din yung iba din sa 12 years old. Of course, sa 12 years old, mas kaya na po niyang maintindihan. So, ang approach po dyan is, I think, more, let's say ganito, pag bata po is more playful. Play. May kasama pong play. Kasi ang bata, nandun ang ang mga bata, so hindi pa sila active sa katulad ng ginagawa ng mga matatanda na nag-iisip ng ano ba ang dapat kong gawin, ganito, ganyan. So, ang mga bata is, dun po sila mas nahahata. Playful way. So, pagdating po sa ganun, sa music therapy, ganun po yung approach. So, may pagkakaiba po sa music therapy.
Thank you for that information, Tish. Yung next question ko, Tish, is yun po bang pagiging multisensory na music therapy? How does it relates or benefit naman yung mga children nga na may sensory issues?
First of all, ang music po activates all brain areas. So it
Mhm.
means na wala pong specific area ang music. So for example, kapag nakarinig po tayo ng music, kapag nandiyan ang music, lahat, buong part ng brain natin is active. So,
Oh,
opo. So, for example, nakinig ka ng music na of course na important sa'yo or alam mo. Pag nakinig ka po, mare-recognize mo yung lyrics, yung melody, and kasama po diyan yung meron kang maalala. Like for example, galing, sinayaw ko yun. Oh, kinanta ko yun ng ano. Uy, kinanta yun ng favorite singer. Ganito, ganyan. So, memory and at the same time, motor system natin na mapapasayaw tayo. Kaya po, doon natin makikita na ang of course, naririnig natin ang music. So, doon po natin makikita na lahat ng part ng brain natin is activated at that time. So, memory part, emotional part, motor part, yun po. Music,
galing.
language, kasama po yan. Doon
Okay.
po
Ang
natin
galing.
makikita. Opo.
Multisensory pala siya. Okay. That's interesting, no? Ito po, teach, na-excite ako kasi when I learned that music is a process in both nga, the both brains, hemispheres ng brain natin. Ano ba yan? Nabasa ko kasi bigla to eh. What does that mean? Kasi I think correlated yan doon sa una mong nabanggit na it activates or sa
All
lahat ng
brain
part ng
areas.
brain. Oo. And we have left and right brain, di ba? And then,
Yes.
how does it relate to that? Paano po yan? How does it mean? What does it mean?
Well, based po dun sa nabasa ko, na research ko is, of course, pag sinabi po natin all brain areas activated, of course, left and right hemispheres po is, kumbaga, na-activate din.
Mm.
So, based po dun sa nabasa ko, yung, of course, ang right side is the creative part, and the left side, yun po yung logic part ng brain, right? So, dito po napaprocess ang speech, and then sa right side is yung abstract thinking, creative, so pag ano ko sa art, so more on the right side. Ngayon po kasi between sa left and right hemispheres, meron po diyan yung nerve fibers na nagko-connect po dun sa dalawa. So hindi lang po siya yung dalawang nakaganyan, may nakakonect po
Nakaganyan.
dyan sa in
Gitna.
between.
Ah.
Opo. So, medyo gagamit ako ng term, yun yung tinatawag nila na corpus callosum. So, ano lang po yan, let's think na ano yan, parang ano lang po siya, nagko-connect, something
Mm.
na nagko-connect between dun sa dalawang hemispheres. So, pag nakikinig po tayo ng music, yung neurons or yung mga messengers dito po sa brain natin, ay na-activate po sila. So, pag na-activate po yung part na yan, yung tinatawag na corpus callosum, na-stimulate at the same time yung both hemispheres. Kasi po kinoconnect niya yung dalawang hemispheres eh. So meron po talaga siyang may activity. May activity
Mm.
po. So
It's
parang
not
yun yung explanation kung bakit both hemispheres ay um, na-activate pag
na-activate. Oo. No
music.
function.
Opo.
Oh, okay. That's nice. For kids naman, teach who are struggling with speech, no? Na-mention mo kanina, was it right side? O left side yung speech? Anong
Left side po.
left side po,
Actually,
left side. So yung left side is for the speech. So can actually music therapy help with that? And if ever, paano po?
Puwede po siyang makatulong, for example, through singing. Of course, 'pag kumakanta po tayo, gumagamit tayo ng words, right? So, pero nilalagyan po natin yung words ng melody. So,
Yeah.
and yung rhythm po ng music as well as yung repetitive patterns, kasi po music is my structure, right? So, yung repetitive pattern within the song, yung tumutulong po yun para ma-memorize natin yung words. Because
Okay.
music is rhythm and rhythm is structure. Pagdat ang structure po is mas madali siyang maintindihan ng brain natin kasi may pattern. So,
Mm-mm.
our brain is all about, I think, patterns. So, kaya po, yun po yung nag-explain kung bakit pagdating sa speech, mas madali ang pag-aralan ang language kapag may melody through singing with help of rhythm, kaysa sa yung tuturuan mo lang siya, okay, you pronounce this. So, dito po papasok yung video na
Yeah.
sinulat ko.
Oo. Sige po.
Yung,
I-share po po yun. Wait lang po.
konting explanation lang po yun sa kung
Sige.
bakit
Panoorin
nakakatulong.
po natin.
Opo.
I'll just click here. And i-share ko po yung screen ko.
Nakalimutan ko po sabihin, predictability pala. Yung predict. Opo.
Wala po siya. So, I need to, okay, here. So, we have here,
doing what I asked them to do.
60, was it 609?
619 po. 619.
Okay, 619. Okay.
Yes.
Yeah. Ayan, dito natin po simulan.
Opo.
At that age. So I would use that when I work with them. And I believe that it works well because it's increasing dopamine production in the brain. And with more dopamine, there's a better chance that those new connections are going to be formed. The second characteristic that I think is unique to music and music therapy is the actual signal, right? I like to say noise is bad, music is good, right? So noise is a difficult signal for the brain to understand, right? So, and research has shown that to be true, and that it's really not so good for brain development, and it doesn't help make new connections at all in the brain. In contrast, you can see that music is much more periodic and much more structured, and is easier for the brain to encode. So let me give you an example. Okay, so I don't know if any of you have children. I have two, and when they were little, about 2 or 3 years old, I'd tell them, pick up your toys. Go pick up your toys, right? And they would just look at me. Okay, go pick up your toys. Or they would just kind of keep playing with their toys. Like they didn't understand what I was saying. However, if I did something like clean up, everybody, everywhere. I'm sure you've heard that song, right? Somewhere. It's getting there, right? All of a sudden, it was a miracle. Kids started picking up their toys. They're like, oh yeah, mom, doing it, right? So people might say that music grabbed their attention. It was more fun with music. That could be true. But I would suggest that maybe for a young brain, the speech signal, which is a little bit more noisy, was more difficult for them to understand. And as soon as I embedded that information in music, which was a clearer, easier information for them to understand, they heard me, they processed it, and they started doing what I asked them to do. So what does this have to do with music therapy again? Well, research has shown that professional musicians actually have a more clear, less noisy signal, vocal signal or instrumental signal, than non-musicians. And music therapists are professional musicians. They are.
Can I already stop it doon?
Opo, ang ganda na po yan.
Okay. So that's very interesting kasi ko-connect ko lang din dun sa personal experience ko with Louie. Even now, I feel that pagka meron sila na siya mismo, pagka meron siyang certain words din na nahihirapan siyang maintindihan, I would always try to put out YouTube video and then to try kong ipaunawa sa kanya what does it mean. Pero nagkukuha ako ng let's say mga stories, children's stories, and then there was a word na hindi niya alam, doon niya makuha doon sa YouTube video na yon na nabanggit doon sa story na yon since he actually gets understand it, and then at the same time pagka ano na rin kami nung kanta, yun na, maintindihan niya, okay, yung pala ibig sabihin nun. So yun, parang I think yun yung mako-correlate ko dito na experience sa very particular na YouTube video na to. Thank you for sharing that, Tisha. That was very interesting.
Okay, welcome po.
Yan. So, dun naman tayo sa session, sa mga sessions mo. Pwede bang kasi ang sessions mo sa for dementia people eh. Pero I think for the point of view nung halimbawa mga bata naman yung may session for music therapy, can the parents actually join during the music therapy? And doon na kung sakali man kasi mga matatanda ngayong ano mo, can you describe to us ano yung nangyayari during a music therapy session?
Yung pong question na kung pwedeng mag-join ng parents, of course, pwede pong mag-join dun ang parents kasi po, especially kapag po yung goal ng treatment is may kinalaman sa relationship between parents and their child or children. So, pwede po yun. Pwede po talaga ang parents doon na ma-involve. Yung sa music therapy sessions po, like for example, sa setting po ngayon ng work ko or sa...
Yes po, yung sa setting yung work nyo na may matatanda kayong during music therapy sessions nyo, can you describe ano po yung nangyayari? The beginning, yung gitna, and then the end po.
Sa music therapy session po merong clear na structure. So for example, meron nagsa-start lalo na po sa mga matatanda, meron kaming laging welcome song and then meron kaming song na pagkatapos na. So para po maisip nila na agad na okay, magsa-start na tayo sa music therapy and tapos na ang music therapy. So kailangan po talaga may i-indicate mo, talagang ipapakita mo po sa kanila yon. And then, depende po yun sa goal ng therapy. Ang music therapy po kasi, meron tayong treatment plan. So, meron tayong goal na gusto nating sundin. So, para po depende po yun sa client, sa goal ng client. Pero po, as a music therapist, importante din po yung moment-to-moment na experience. So, for example, ang goal ko today is to help my client to relax or to activate my client. And then makikita ko po na sobrang kumbaga distressed ang aking kliyente. So, doon po kumbaga i-tune ko yung therapy depende po sa nakikita ko at that moment. For example, kapag kailangan ko siyang i-activate pero nakikita ko masyado siyang hyper, of course, mas pipiliin kong tulungan siyang mag-relax kaysa sa sundin ko yung goal ng therapy sa kanya. Kasi po, of course, everyday, iba-iba ang mood. So, depende din talaga yan. Lalo na po sa mga matatanda na mga dement. So, hindi na po sila aware of course, sa sakit nila and then sa kung ano nangyayari sa paligid nila. So, in that way, sa music therapy, talagang yung experience po ng moment na yon ang talagang tinitignan natin sa session. And then, mayroong clear na structure. So, magsa-start, mag-e-end. Ganun po. So, sa mga sessions, depende po. Pwedeng, for example, mag-play ng music together or kakantahan ko yung kliyente or makikinig yung client sa preferred music. So, iba-iba po. Depende talaga siya.
Ano yan? Teach me, nire-require kayong mag-create ng parang summary of what has been transpired, pati yung report. Like for example, nire-require kayong mag-submit ng ganyan to the relatives ng patient?
Meron po kaming system kung saan doon po kami nagre-report and nababasa po yun ng family po nila.
Family
So, buong organization kung saan po ako nag-work, nababasa po yung lahat ng department, nababasa po ng mga doctors yun, psychologists, ng mga caregivers, family, nababasa po. So, at the end of the day, may need po namin mag-report.
May feedback po.
Opo.
Okay. Helpful po kasi yun if ever, para kung sakaling bawa may moments na may gathering yung family, tapos that particular music that you introduce work well with the patient, so maaari nilang gamitin yung music na yun during the gathering ng family, parang something like that yung naisip ko.
Opo.
So,
Yung pwede pong makatulong. So, nagbibigay din po kami ng ideas, ng tips, advice, kung ano po ang pwedeng gawin, especially po sa mga caregivers. Kasi, most of the time, ang problem, nag-a-appear po yan during ng care sa mga matatanda. So,
opo.
po yun. Kung ang matanda, nare-relax sa music, then, bibigyan po namin sila ng advice, okay, sa ganitong klase ng music, nare-relax siya. So, try this and then we'll see kung mag-work during the
Yeah.
care.
Thank you, Teach. Sige. Ay, yung pong Teach, yung ito na isa lang natanong din to sa akin, isa sa mga parents before.
Yes.
Can the parents do music therapy at home? I'm just thinking of yung halimbawa mga indigent na Filipino families
Mhm.
who won't be able to afford someone na mag-hire sila ng music therapist. How can they implement this sa bahay? But of course, huge difference. I know there will be a huge difference pa rin na kailangan talaga, I think, yung specialist talaga dito to run the session with their child, if ever, or their family members.
Opo. I think pwede pong i-apply ang music therapy ng parents, pero ang music therapy po kasi pino-provide po talaga yan ng trained music therapist. Kasi po, katulad nga po ng na-discuss ko earlier, meron po tayong sinusunod na treatment plan and then depende po yan sa problem kasi na talagang tinitreat natin kung sa patient or sa clients. Bali, kasi po, after ng sessions, ini-evaluate po yan. Pero pwede po naman po natin tignan ng music therapy as non-clinical. So for example, hindi po natin kailangan galing tayo sa psychologist para masabi natin na okay, ito ang dapat na treatment sa client na to. Pwede po natin siyang i-approach as non-clinical. For example, katulad po ng ginawa ninyo sa anak po ninyo sa noong time na emotionally distressed po siya. So, nag-apply po kayo ng intervention. Like, okay, magpapatugtog ako ng relaxing music. And then, tingnan natin kung anong magiging effect. And then, nakita niyo naman po yung effect. So, that is what I would call non-clinical kasi po hindi naman siya talaga binase no sa hindi naman siya napag-usapan ng doctors ng
Yes,
psychologist
ako.
not in a clinical setting. So in that way pwede po nating of course pwede po nating i-apply ang music intervention. Pero when it comes sa therapy, ano po 'yan, bali pino-provide po talaga siya ng licensed music therapist. Yun lang po yung difference.
Ako.
Of course, music intervention, pwede po nating gawin yan. Opo.
Sige po. Yan. Thank you, Teach. Ang dami ko learning today. Sobra. And sana kayo din, dear parents. And before we end this awesome connection kay Teacher Jenjen, Teacher Jenjen, sorry, I know you have mentioned this to me na may page ka, pero where po nila kayo pwedeng matanungan, makausap, or if they would inquire something about the program, let's say they have family members then there na taga Netherlands na old people who has the dementia, where they can connect with you. Can you let us know po paano kayo contact?
Apo. Thank you. Una po sa lahat, thank you po sa pag-invite mo sa akin dito, Ma'am Loy. And thank you po sa mga umattend po dito sa live stream na to. And I hope na kahit pa paano po nakapagbigay ako ng helpful na information tungkol sa topic po na to. Bali, meron po akong page, yung tinatawag na Inner Tune Healing. Yun po yung page ko. Hindi pa po siya masyadong hindi ko pa siya nahaharap kung tutuusin kaya hindi po ako masyadong active diyan. So nagpo-post lang po ako ng mga something na pwedeng like inspirational, but it's all about personal development and of course involved po talaga ang music diyan. And kung meron po kayong mga katanungan regarding po sa dementia or autism, ADHD na pwedeng kumbaga kahit pa paano meron akong may input, maitulong, feel free po to message me sa Inner Tune page ko po, sa Inner Tune Healing, dun po sa page ko. Opo.
So, Inner Tune Healing po, no? Inner Tune, as in T-U-N-E.
Opo. One word po yung Inner Tune, tapos healing.
Healing. Okay. Sige. Yung FB page ko, ipa-flash ko ngayon. FB page ni Teacher Jenjen. Sorry, I forgot to add this kasi kanina before our discussion. Ayan. Thank you for again, thank you Teacher sa pagpapaunlak ngayon. Well, that's all for today. That's all that we've got for today. Thank you for joining Live with Mami Loy's Awesome Connection. And sana, dami po natin na-discuss talaga dito about music therapy. We appreciate you watching us and hope you learned a lot from this discussion. And again, thank you, Teacher Jenjen. Thank you very much as well. Till next episode po here in Awesome Connection. Thank you.
Thank you po.
Thank you po.